Tumaini TV ndio mshirika wako wa karibu wa matangazo ya kibiashara. Umati wetu mkubwa unasubiria kusikia ambacho utawapa kwa leo. Mbona usiongee nasi leo? Chukua fursa hii utupigie simu kwa 0.
Welcome again to Afya Yetu, a TV show which deals with matters health. So with you is your host Collins
and Dr. Oyugi.
Okay. So the show is brought to you courtesy of Nyaluk Foundation. Nyaluk Foundation is a local NGO which deals with sexual and reproductive health, mental health, dental care, eye care, and gender-based violence. So to catch us on the show, we are live on YouTube, Facebook, and also you can catch us live on Instagram at Tumaini TV KE, and to SMS us you can get us through 0110 100 258 or 0736 991 958. I'll repeat, 0110 100 258 or 0736 991 958. So to start us off today, we want to do management of ectopic pregnancy as we promised earlier. And to start us off, I'll start with a question where our viewer wanted to know what are the modalities for, like, maybe aliuliza kama uko na ectopic pregnancy utajuaje kama imerupture ama ija rupture, as in ni early symptoms of rupture and unruptured ectopic pregnancy. So I'll take you straight to Dr. Oyugi, which he'll try to explain to our viewer how will you evaluate and know where your ectopic pregnancy is ruptured or is not ruptured. Feel welcome, Daktari, and you can help us understand how early signs of ruptured ectopic pregnancy and non-ruptured ectopic pregnancy.
Okay, thank you so much, Dr. Collins. I remember we demystify about the same last time when we were doing classification of ectopic pregnancy. Actually, that's a broad classification: ruptured and unruptured. Then we have the other classification of the ovarian, the uterine, and the abdominal ectopic pregnancy. So the most important one is the ruptured ectopic pregnancy, which is obstetric and gynecological emergency, and they have specific symptoms. These are patients who comes with severe abdominal pains. They come with PV bleeding. Okay, PV bleeding is parvaginal bleeding. The pregnancy test is positive. If you touch the abdomen, is tender. There's something we call guarding rigidity. You feel there's too much tenderness and there's too much abdominal pain. So that is actually, sometimes they come without PV bleeding, but actually it has ruptured and the blood goes towards the abdomen and all that. Yeah. So the unruptured one, it's one that it has not haijapasuka.
Yeah.
Unaona? So it might end up growing slowly, but the pain is not sharp. It's a dull pain. You just feel the pain, but it is dull. But the most important thing, as I said the last time, is the pregnancy test has to be positive. Then the diagnosis has to be made by, we had the couldocentesis, the one that we talked about, put a needle, then get that blood that is not clotting.
Yeah.
Another thing that we talked about was radiology. Do an ultrasound. It will give you specific place where that is.
The pooling of the blood, right?
Exactly. But the biggest difference is the nature of the pain that is there. Yeah. The unruptured, we have a dull pain that is chronic for some time. Yeah. Or it may not even be there. Okay. You might get it like an incidental finding. Yeah. But the ruptured one, it is so specific. This is a patient. Okay, another thing, this patient might come with features of shock in a ruptured one.
Yeah.
because you know they're losing blood. You get it? So you have the extremities like the hand and the legs, they're cold. Yeah. You look at them, they're pale, things like those.
Yes.
Yeah, you feel their heart, it's pumping so fast. We call those things like hemic murmurs and something like that because they're losing blood.
Yeah.
Sometimes they come with fainting attacks. Yeah, and all that.
Okay.
The unruptured one, they don't come with that kind of symptoms. Yes.
Okay. So to to our viewers, just in case you are joining us for the first time, last week we talked about ectopic pregnancy, and Daktari elaborated that ectopic pregnancy is any pregnancy outside the uterus. So the uterus is a bag is like a bag, a womb where normal pregnancy occur. But if you have an implantation, mtoto amejiattach nje ya uterus, that's what we call ectopic pregnancy. And just to recap on what we said last week, I think Daktari, you can just maybe elaborate many sites where this ectopic pregnancy can take place before we go to management.
Okay.
So that maybe if you are joining us for the first time, you are kept abreast.
Okay. As you said from the definition, this is a fertilized ovum that is not implanted in the endometrial cavity. Endometrial cavity, it's the uterus, the walls of the uterus. But we have several sites where they are. Yeah. This is actually the fallopian tube. Yeah, okay, there's the uterine, there's ovarian, and there's abdominal. The uterine, it can be on the cervix, anywhere within the uterus that is not the endometrium.
Yes.
That can be the uterus, it can be on the muscles, it can be on the fallopian tube. And fallopian tube is the most common place where you get the ectopic pregnancy. You can get it on the ovaries, so we call it ovarian ectopic pregnancy. Then finally we can get it in the abdomen. In this abdomen you get it in places called the ligaments. These ligaments are things that help to anchor the uterus into its place. So you can get it there.
Yeah.
Yes.
Okay. And maybe to take you through maybe signs and symptoms. So as we agreed on earlier last week, that we said that signs and symptoms of ectopic pregnancy, as in how the patient will present, venye utapresentia daktari or venye utajua uko na ectopic pregnancy. So the patient will have bilateral abdominal pain. Bilateral abdominal pain, it means that the pain is on both sides because it radiates here. So you'll have a history of amenorrhea. Amenorrhea is
lack of periods.
Lack of periods. Yeah. Venye daktari alisema the pregnancy test has to be positive for you to have ectopic pregnancy. Then another sign is pervaginal bleeding. Then with ruptured now, you'll have peritoneal irritations. Peritoneal irritations, venye ameeleza hivi, ni some serious discomfort. Na hiyo ndio sasa tunasemaga ati maybe mtu ako na kitu ingine inaitwa acute abdomen. Acute abdomen is a very severe pain on the abdomen. Abdomen ni tumbo. So to take us now to our today's topic, we wanted to do management of ectopic pregnancy. So for management, we have different type of management. We have like from the laboratory to surgical to non-surgical. So surgical is theater and non-surgical is where we use just drugs to manage your case. But that one will depend on how you present and which stage of ectopic pregnancy you'll present with. So Daktari, if you might take us through like maybe these patients when they come, what will you do? Or will you just see this one and you know that this one has ectopic pregnancy? So how will this patient present, maybe from history to examination to maybe to where you'll request for lab?
Okay, actually, if I remember very well, we did all that last time.
Yeah.
And now we are doing the management of it. And yes. I'll put it as the part of the broad bit of it, either ruptured or unruptured.
Yes.
The ruptured one, as I said, it's obstetric and
Emergency.
gynecological emergency, reproductive health emergency.
Yeah.
And these are the patients you have to check on the HB. No, okay, fine. You have to check on the HB, do something we call GXM. We need to know the blood group, which is it, order for the blood immediately. And these are patients we need to rush for theaters, wait for the blood.
Yes.
Because it's, the ruptured one is just like a tap. Ni kama kuna unaweka damu, but tap inatoka. So you have to look for where it has ruptured and where it is bleeding, because those blood vessels are open.
Yeah.
So you need to close it up
Yeah.
and deal with it urgently.
Yeah.
Yes.
Just to cut you short, Daktari, the reason as why we are saying that ectopic pregnancy is a medical emergency is because for one simple reason. The blood that supplies the uterine and the ovaries and the tube comes direct from the aorta, and the aorta is controls, it has a lot of blood. So if you are bleeding from a branch direct from the aorta, so you lose a lot of blood within no second.
Yes. You
So
can
that's why
easily
it's a
lose.
very serious condition.
Yes.
So Daktari, just continue with the management.
Yeah, so before we get to surgery, because basically the ruptured one, it's purely surgical management.
Yes.
There's no medical management for it.
Yeah.
But for the unruptured, you can do non-surgical management. There are drugs that can be given, but I cannot speak about those drugs here because, you know, most of us are naive. They can just go and buy those drugs.
Yes.
But the most important thing is these medical, obstetric emergencies, gynecological emergencies, it's important to see a gynecologist first before anything else. So the diagnosis is, these are patients who comes to you, has a vaginal bleeding,
Yes.
whatever we talked about.
Yes.
Then they're saying that they've not been seeing their periods,
Yes.
for like more than a month and so.
Yes.
If you try to calculate the last time they saw their periods, it's like 2 or 3 months ago. Yeah, you do your pregnancy test, it's positive. Then actually you do the ultrasound, you scan, their abdomen, and you realize where it is. Sometimes they hide.
Yes.
And there's the important ultrasound that we do. It's called transvaginal sonography.
Yes.
So that ultrasound at least can look at where the tubes are and all that, and can locate specifically where they are. So still on surgical, there's something I can talk about. Yeah.
Yes.
There's that complete cut off. I'm trying to talk about them in a layman's language. You can completely cut the fallopian tubes and the ovaries according to where the site is. But sometimes there's something we call milking, reconstructive surgery. You cut and remove whatever that is there, then you suture. But what happens with that, the rate of recurrent is so high. These are patients who might come back with another ectopic pregnancy. So there's possibility of that. You cut, you milk and all that, because you're trying to do, as much as we call it tubal sterilization and something like that. But still, because the way it heals, it might end up narrowing the place. Things we call adhesions and all that.
Yes.
Yes.
And I think also maybe, just to my thinking though, maybe, you know, when you cut and you suture, the place will heal with a scar.
Yes.
So
scarring also, the cilias are gone and all that.
Yes.
There's that possibility also.
Yes.
Yes.
So now in such like cases, now if you are to advise this patient, maybe he had one ectopic pregnancy and he has come now, he has another ectopic pregnancy. So what will you tell this patient? And before we go there, I wanted to know whether, you know, like you said that these patients, they need to see a gynecologist.
Yes.
How many gynecologists do you have in Kenya as we speak? And what I know for a fact is most gynecologists are in town. They're not there in the villages. So I don't know if maybe somebody is in the village.
Okay, for instance,
Yeah.
Right now I can say that there are so many gynecologists now.
Yeah.
Yeah, for the hospitals in Nakuru, I've seen like one private hospital has like 8 gynecologists. And if you go now to private, there are so many. If you compare them with surgeons or physicians, nowadays they are available. And then these services, they are there in government hospitals. Yes.
Okay.
So they are available.
So you are saying that the gynas are all available under. What if you don't
No,
get
I can't say 100%, yeah?
Yes.
But they are there. Yeah, in most of the hospitals around, I've seen you cannot miss a gynecologist.
What if you don't get a gynecologist? What are the options there for you?
Okay, if you don't meet a gynecologist,
Yes.
I believe the medical officers that are there, they are well trained on these cases.
Okay.
So just in case anything happens, it's too much of an emergency and something like that, there's also a referral option.
Yes.
So you need to stabilize this patient first before you send this patient to the next facility.
Okay.
Yeah.
Okay. Now, back to our viewers. In case you are joining us for the first time, we are live on YouTube, Facebook, and Twitter. YouTube, Facebook, and Instagram. Also, you can follow us at Nyaluk Foundation on Facebook, Nyaluk Foundation, on Instagram, Nyaluk Foundation, and Twitter, Nyaluk Foundation. And if you want our services, we are in Nakuru town, Nasha Plaza, first floor. There are some questions which are coming in, but we cannot say them on camera. So if you have anything personal, anything pertaining sexual and reproductive health, mental health, eye problems, kindly visit us at Nasha Plaza, first floor, opposite Mheshimiwa Hotel, Mosque Road. So, Doc, now you've said that we do, after investigating, we can, we do maybe
Either surgery
or medicinal.
Yeah, exactly.
So what I wanted to know, what are the aftermaths, like as in complications of ectopic pregnancy? One, we've said maybe he can have a recurrence.
Yeah, that is true.
Maybe they can also develop what's called infertility secondary to tubal scarring and what are other issues related to?
The other issues that come is when these patients come and it is late, there's that possibility of having what? Bleeding a lot, they lose blood.
Yes.
It might even lead to death.
Yes.
And that is why we were saying it is so much risky.
Yes.
The one about infertility is when it happens between both tubes, and we have to work on both tubes, So that's another thing. That's when the infertility comes in.
Yes.
So another thing is if the procedure is not done in a very good way, and that's why I keep on insisting, see a doctor, see a gynecologist, Yeah, they might end up into infections. This infection can get into bloodstream, they get sepsis, and they can still kill. You get it?
Yes.
Yes. Yeah.
So there's a patient here, I don't know, it's not a patient, there's a subject asking that she was done an ectopic, he had an ectopic pregnancy, she was done a surgery, and now she suffers from a chronic backache. What's the relationship between ectopic pregnancy or surgery and chronic backache?
Okay, actually, now that also depends with the kind of surgery that was done. We are not specific what kind of surgery was done.
Yes.
And if you look very well, when you go through another thing is also specifically where was that ectopic pregnancy was. Because if you go through the round ligaments and all that, there are nerves that passes there. And you know very well, from a female uterus, there's no male uterus, right? So from that uterus,
Yes.
actually most of the pain that they get, whether pelvic inflammatory disease, whether infection and all that, usually goes to the back because of the nerves where they're located and something like that. So this is a patient who needs to go back to a gyna with the discharge summary that was given, so that this gyna can be specific and get to know what was done. Yes.
Okay. I thought it was related to maybe anesthesia.
Yeah, anesthesia is possibility.
Yes.
Yes, but you know, that's what I'm saying. It depends on what type of surgery that was done. Because if this patient comes bleeding,
Yes.
yeah, we don't give the spinal anesthesia. We usually go direct to general anesthesia because you want to save this life. This is a person who is bleeding profusely and all that.
Yes.
Yes. So you go deep, cut, do whatever surgery you want to do, stop the bleeding and all that. You get it? Because GA is so much faster than spinal. Sometimes you can try spinal and you don't get it. It takes time. And this patient is still bleeding. So that's what I was saying. The kind of surgery, the kind of procedure that was done need to be checked. Yes.
Okay.
Yeah.
Then there is somebody by the name Jerry Wamboi. She's asking that she was done a surgery. She had an ectopic pregnancy. She was done a surgery. Then the wound did not heal. She was told to go back to theater again. So she did like 3 theater visits.
Oh,
then,
sorry.
Then now she complains of hernia. She has a swelling on the surgical site.
Okay, Jerry, I would say sorry about what might have happened during that time. But if you see somebody being taken to theater back because of the wound that did not heal, there are so many factors around this patient. One, it could be sepsis, the infection we're talking about. Maybe they didn't use aseptic measures. Aseptic measures is when you clean and all that and make sure you follow what is supposed to be done. Second thing, maybe the kind of antibiotics that were given, they did not cover prophylactically. Another thing is all about the immune system of this person. Yeah, all those can lead to that. As we talk about, these other factors like things like DM, hypertension, you get
Even
it? Obesity, yeah, they can all lead to that.
Yes.
Especially now. Now, another thing is, if she was taken to theater 3 times, means that that site was infected. And you know, we usually do secondary sutures. There's something we call rectus. If that rectus is not closed well, there's a possibility of hernias forming. So that's another thing. And I would advise Njeri to go back to the GENA. Then,
So,
yes.
okay. So she should go back to gynecologist so that they can repair the hernia?
Reassess. Yeah, she should be reassessed and all that.
Okay.
Yes, it's important.
Okay. I get it. Okay, we are so sorry about that, Njeri, and it's unfortunate it happened. I also had a patient who had the same condition, and I think now she fear going back to the theater.
Actually, what I would say, she doesn't have to fear going back to theater.
Yeah.
It is so much important for her own health and all that.
Yes.
Yes.
What I know for a fact, you know, people fear theater.
Exactly.
And I think, I don't know, must it be an open surgery? Can they do like...
Okay, there's laparoscopy.
Yes.
And we don't have it everywhere. The same reason that you asked me, if can we get gynecologists everywhere?
Yes.
You don't expect. Okay, I know there are hospitals that are private. You can get them some uko mashinani kabisa. Yeah, but you actually don't get those laparoscopic surgeries around there. But then they have their repercussions.
Yes.
Because after that, the recurrence, it's going to be there. Yes. So
you can do a laparoscopy,
yes,
hernia repair, and you get a recurrence.
not hernia, the ectopic pregnancy.
Oh yeah.
You can still do that.
Oh yeah.
Yes,
Yeah. Sure. Okay. I think Daktari, you've given us a lot of information pertaining the ectopic pregnancy, and our viewers have also asked so many questions which are so in accordance to what we are talking about, and I think at this juncture, what we can tell for sure is people have so many medical issues, and ectopic pregnancy just being one of them. And I think no woman should lose life while giving life.
Yeah.
I think that's the whatever is being said by the gynecologist and the mortality. So I think at this juncture, we'll end our show. And if you have any question, we are live on our social media platforms. You can always ask, and when we come back for the next show, we'll make sure that we answer whatever you ask before we start the show. And if you have anything, like I see so many people asking questions which we cannot air on live, but you can always find us at Nasha Plaza, first floor, and Dr. Oyugi is always there to attend to all the gyna patients. And I think that's it. And I want to take this time also to thank you so much for tuning in and staying with us. And we apologize for the hitches we had when we were starting the show. It was a technical issues. So I want to give Dr. Oyugi a chance also to give his closing remarks.
What I can say, I just have a quote for my viewers, especially on ectopic pregnancy. Now that we are done with that topic, I believe the more questions that come, we always have these shows every Saturday from 6 to 7. So we'll still reply to those questions. So my quote was, pregnancy in the fallopian tube is a black cat on a dark night. It may make its presence felt in subtle ways and leap to you, or it may slip past unobserved. Although it is difficult to distinguish from cats of other colors in its darkness, illumination clearly identifies it. Why I gave this quote, it's because that when it is the ruptured one, it is a cat that is being observed. But if it is not ruptured, especially those who use pills, you get it?
Yes.
They will never know if they have an ectopic or not. So it is difficult to identify. But if you feel any abnormality as a woman, you have either dull pain or severe pain, and you've missed your periods, kindly seek medical advice. It is important. Thank you so much.
Okay. Just to close the show, I want to really thank somebody by the name Rich Favor. He has a lot of questions, but this one we tackled last week. So if you can go and watch our show on last week, you get all the answers. And also somebody by the name Alex Wangoi. We appreciate your time and effort to reach us through our social media platform. And this show, always remember, is your show. So anything you feel like you want discussed, or even if maybe you are a survivor of a certain condition and maybe you want to give testimonies, you want to tell other viewers, you want to maybe to give a word of encouragement to somebody who is having the same condition, you are always welcome to the show. You will be given a platform, we'll interview you, you never know, you'll be encouraging another person somewhere, maybe who is suffering from the same condition. Maybe you can just give your live experience. So thank you so much again, and we meet next Saturday when we'll be talking about family planning. You know, family planning is a very broad category, and maybe just to start us, maybe what to expect, we'll be talking about different types of family planning, indications of family planning, who should get what and who should not get what, and side effects of family planning. Maybe you see, maybe you are having this family planning and you are gaining a lot of weight, things like that, and maybe you have maybe high blood pressure, diabetes, obesity, and you're told now you cannot use family planning, you cannot use this, and you are supposed to use the other one. So those are the things which we'll be tackling. And as we are aware that family planning is a bit of a controversial thing in church, and I think we'll be clearing the air. And at that point also we'll like to invite maybe a pastor or somebody who is in the church so that maybe he can tell us his point of view. Okay, thank you so much. Until we meet next time, God bless.
Je, ungependa kuwafikia wateja wengi? Ungependa kuongeza mauzo yako licha ya hali ya sasa ya kiuchumi? Basi Tumaini TV ndio mshirika wako wa karibu wa matangazo ya kibiashara. Umati wetu mkubwa unasubiria kusikia ambacho utawapa kwa leo. Mbona usiongee nasi leo? Chukua fursa hii, utupigia simu kwa 0736991958 ama 0778251419. Vilevile unaweza tuandikia barua pepe kwa info@tumainitv.co.ke. Tumaini TV, bringing hope to the nations.